And bakit po ibinalik itong Metro Manila under MECQ? Ayon po sa report, ay ito'y bungsod sa request ng mga healthcare workers natin sa iba't ibang sektor ng healthcare workers na muling ibalik yung NCR sa MECQ dahil sila po ay nakakaramdam na ng pagod at mababang moral. No, so time out muna for weeks ang kanilang hinihingi para mabawasan o maampat ang pagpatuloy o ang patuloy na paglobo ng mga kaso ng COVID-19. So, bigyan ng tamang pag-aaral, yun ang hinihingi nila sa ating presidente, kung ano pa ba ang dapat gawin para mabawasan yung paglobo ng COVID cases. So, ayan po, wag na nating ipagpilitan kung gusto nating bumiyahe dahil again, MECQ, ibig sabihin ang papayagan lang lumabas na naman ay yung may mga valid reasons para lumabas. Of course, mahigpit na ipinatutupad yung minimum health requirements. So, kailangan pag nasa labas ka, susot ka ng mask. And kasama na rin sa bagong implementation ay yung pagsusuot ng face shield. So, yung face shield that deters mga 93% ng transmission. So, mas mainam kung meron ka ng mask, meron ka pang face shield. And then, of course, yung frequent hand washing at yung physical distancing at least 2 to 3 meters. So, ayan po. Para sa ating mga kababayan, sana maintindihan natin lahat ng kagustuhan ng ating mga medical practitioner ay magkaroon ng konting pahinga sapagkat sagat-sagat sila mula nung magumpisa itong COVID-19 dire-diretso na sila sa pag-asikaso sa mga may karamdaman at dumadami at nababawasan din yung ating frontliners, dumadami yung naapektuhan ng COVID. So, maganda naman yung naging response ng palasyo regarding sa request ng ating medical frontliners, medical health workers request. So, ayon dito sa report, this report comes from GMA. Various medical associations on Saturday called on President Rodrigo Duterte to place the National Capital Region to enhance community quarantine as health workers are already worn out due to the rising numbers of COVID-19 cases being admitted in hospitals. The medical community appeals for return to enhanced community quarantine in Mega Metro Manila from August 1 to 15 to calibrate strategies against COVID-19. According to the joint letter read by Philippines Medical Association President Jose Santiago in a virtual press conference. So healthcare workers are united in sounding a distress signal to the nation. Our healthcare system is overwhelmed, Santiago said. And we have witnessed a consistent rise in the number of infections in this, among other scenarios, prompts us to act now and act fast." End of quote. Signatories to the joint letter addressed to the President Duterte, Chief Implementer Carlito Galvez, and Health Secretary Francisco Duque included the Philippine Medical Health Association, the Philippine College of Physicians, Philippine Pediatric Society, Philippine Society of Allergy, Asthma, and Immunology, Philippine Society for Microbiology and Infectious Diseases, the Philippine League Against Epilepsy, Diabetes Philippines, the Philippine Society of Public Health Physicians, the Philippine Academy of Pediatric Pulmonologists, the Philippine Society for Pediatric Gastroenterology, Hepatology and Nutrition, Philippine Urologists Association, Philippine Ambulatory Pediatric Association, the Philippine Society for Development and Behavioral Pediatrics, and Child Neurology Society Philippines, among others. In the same virtual press conference, the Philippine College of Physicians Vice President Encarnita Limpin reiterated her call to place Metro Manila once again to ECQ as frontliners are overwhelmed. Start of quote, "Kaming mga frontliner ay napapagod na. Kumakaunti na po kami." End of quote, Limpin said. She said that the medical frontliner are only for just a 2-week timeout. In a separate statement, however, presidential spokesperson Harry Roque said the strict lockdown has already served its purpose. For her part, the Philippine Society of Public Health Physicians, Dr. Lei Camiling, noted that easing the lockdown has given a false sense that the COVID-19 situation has already dissipated. But Camiling said the situation is not getting better. Santiago likewise said that the healthcare workers are falling ill as they take care of patients, responding to the call of duty while battling the fear and anxiety that COVID-19 brings. Our health workers are burnt out with the seemingly endless number of patients trooping to our hospitals for emergency care and admission, he said. The Philippine College of Physicians, Dr. Antonio Danz, said the return to ECQ is also an opportunity for the government to discuss strategies with medical professionals. Masasayang lang po ang ECQ kung di tayo mag-uusap-usap at magpaplano. Kaya nananawagan kami na mag-ECQ hindi lang para mabawasan yung transmission but also to sit down and talk, Dance said. The medical groups emphasized that the return to ECQ will be used as a time to refine our pandemic control strategies, addressing the following urgent conditions or problems: hospital workers' efficiency, failure of case finding and isolation, failure of contact tracing and quarantine, transportation safety, workplace safety, public compliance with self-protection, social amelioration. And in relation to these, we also appeal to your good office to reconsider the pronouncement of the Department of Trade and Industry regarding the approval of IATF to reopen businesses such as gyms, fitness centers, tutorial services, review centers, internet cafes, pet grooming services, drive-in cinemas, previously due to community quarantine starting August 1, Santiago said. The medical group stressed that if the healthcare system collapses, it is ultimately the people who will be the most compromised. In the end, winning the war against COVID-19 relies heavily on being able to keep our health system capacitated to address the needs of all Filipinos. We hope the government heeds this plea, Santiago said. And this is according to GMA News. So, pinakinggan naman po ng mahal na Pangulo ang pakiusap ng healthcare workers, frontliners natin. Now, this is also the response of the President regarding the request for returning of Metro Manila and other nearby provinces under MECQ. The reports from GMA as well. It says right here, President Rodrigo Duterte has placed Metro Manila and other high-risk areas back to modified enhanced community quarantine for 15 days, effective Tuesday, August 4, 2020, amid the COVID-19 threat. In a briefing on Sunday night, Duterte said that the National Capital Region and provinces of Bulacan, Laguna, Cavite, and Rizal under the MECQ until August 18th. Duterte made a decision on Sunday night on the recommendation of the Cabinet, led by Health Secretary Francisco Duque III, on the proposal for a higher allowance and benefits for medical workers. Duterte also said the government will study the measure, adding they will recommend it to the pending Bayanihan 2 legislation. The government also agreed to other recommendations made by the officials and listed at the meeting by Health Secretary Francisco Duque III, including granting a 10,000 to 15,000 sickness benefit for healthcare workers with COVID-19, the issuance of work and quarantine passes to decrease the number of people going out, and more localized lockdowns. Medical frontliners had asked for Metro Manila to return to an ECQ for 2 weeks to give them time to rest and recalibrate strategies against the disease. In response to the health workers' plea, the Manila Archdiocese said it will revert to the period of the ECQ protocols and will not hold public religious activities for 2 weeks. Metro Manila courts will also be physically closed from August 3rd to 14th as ordered by the Chief Justice Diosdado Peralta. The order covers court in the National Capital Judicial Region and in areas under ECQ or Modified ECQ or MECQ. The courts are mandated to be available through their respective hotline numbers, email addresses, and or Facebook accounts as posted on the website of the Supreme Court. The Senate, meanwhile, is also eyeing for a 2-week ECQ according to the sources. Metro Manila had moved from an MECQ to a less strict General Community Quarantine or GCQ on June 1st, even as cases continued to rise across the National Capital Region and elsewhere across the country. Being under the GCQ allowed more Metro Manila businesses to open and more forms of public transportation to operate, albeit is still at a limited capacity. The number of COVID-19 cases in the Philippines reached 6 figures on Sunday. as a record 5,032 new infections pushed the total to 103,185 cases. So ayan po, pinagbigyan ng ating mahal na Pangulo yung pakiusap ng ating medical health workers at ito'y dinagdagan pa niya ng insentibo. Kumbaga may grant na 10,000 to 15,000 sickness benefit sa mga health workers na may COVID-19. So, yun nga. Huwag po nating ipagpilitan. Inuulit po natin ang panawagan na sa ating mga kababayan na magsimula po bukas August 4, wala na naman pong biyahe ng sasakyan. Maliban na lamang po kung yung inyong pinapasukan ay nag-ooperate pa at po pwede nyong lakarin, bisikletahin. Kung kayo po ay aasa doon sa kayo ay sasakay ng pampublikong sasakyan, wala pong masasakyan. Balik po tayo uli sa mas mahigpit na MECQ. Okay po, paulit-ulit po natin sinasabi, sana po maintindihan ng ating mga kababayan na ang kalaban po natin ay pandemya. Kailangan natin ng makontrol yung pagdami ng kaso. At iyan po ay makokontrol lamang kung i-isolate natin yung ating mga sarili. Yun po yung pinakamagandang control. Habang wala pa pong bakuna. Magpapahinga muna po ang ating mga health workers sa loob ng 2 linggo. Again, huwag po natin ipagpilitan. Wala pong biyahe ng mga sasakyan. Starting August 4 to August 18. Maraming salamat po.